Welcome to Pharmacy View Podcast, where we provide regular interviews with pharmacists and key people within Australian pharmacy and the associated global industry. In this stream of podcast episodes titled RX to Riches, we delve into the evolving global pharmacy landscape, exploring the challenges and opportunities, and examining the current state of retail pharmacy across the globe. With each guest, we discuss the hurdles they face and the potential growth areas that may shape a brighter future for your pharmacy or industry-related business. I'm your host, Michael Alexander, pharmacist, digital health enthusiast, and co-founder of Audirie, an AI-powered communication intelligence platform serving the healthcare industry across the globe. My guest today is proudly brought to you by Shopfront Solutions for all your shelf and digital marketing needs, part of the Erin Technologies Group. Welcome to part 2 of our two-part discussion with Erin Fawcett and Sebastian Harper. I hope you enjoyed as much as I did.
When we're looking at full scope and that sort of thing, we want more interaction between pharmacists, physiotherapists, occupational therapists, speech pathologists, everyone in allied health, and general practitioners, of course, and doctors and hospitals. We want to be a part of that healthcare team. And I'd just love to see us work more as students with people who are already, health professionals in those disciplines, and people who are studying to be those health professionals as well. Because there's a lot of, we hear about turf wars between the disciplines. There's a lot of distrust between health disciplines. Everyone sort of silos into their one degree, which is not a benefit for us as health professionals, but it's definitely not a benefit for our patients, obviously, and they come first. And what I found doing a placement in remote far north Queensland, both community and hospital, was there was so much interprofessional collaborative practice between pharmacists, nurse practitioners, and all those allied health degrees that I mentioned. It was so rewarding to, even on a relatively short placement I was there, to be a part of that, be taught by a nurse practitioner as a pharmacy student was just amazing to me.
I absolutely agree. If you had told me when I started pharmacy that one day we would be prescribing medications, I don't think I would have believed you. I might actually still be working in a pharmacy day to day if that was the case when I started, because it really, to your point, Sebastian, it absolutely means that each pharmacist can work at the top of their scope and access all the skill sets they've been taught from years and years of university study. And it's absolutely critical. The health system is buckling, not only in Australia, but in the US and other places here in the US where I live. There is a huge shortage of what they call PCPs here, or GPs in Australia. The primary care physicians, just they're not enough graduating. There's not enough out in the environment for people to find. There's, if you want to go see a GP here, it literally takes 2 to 3 weeks in some cases to get just in the door. And I know that's not quite as bad in Australia, and thankfully, unless you tell me it is. I don't think it's quite as bad over there, but it is essential that pharmacists step up and fill the gap. And I think the pharmacist prescribing arena is very, very exciting. One thing, and Erin, I'm going to ask, I'm leading to a question for you, is that will mean that pharmacists really will have to be, first of all, trained to prescribe, and then continuously educated on the most recent aspects of certain, not only medications, but diagnostic capabilities and disease states, perhaps to a point or level that they haven't in the past. So I know you are obviously handling the education aspect for NAPSA. What are you looking at in terms of contemporary education tools that'll help train the pharmacists of tomorrow to be able to handle this level of, I guess, practice at the top of their license?
Yeah, so as I touched on before, education is the key to change. And so something at NAPSA is looking at doing is working with people from all over the industry. But something that is, happening that's really exciting is the stuff that we've been working on, Michael, is getting, simulations of counselling to students and introducing that with the Audirie platform to NAPSA, introducing that to students and getting them to really have a look at how artificial intelligence can be incorporated into practice for counselling, and it can be adapted a lot quicker than, say, a university course. Obviously, the courses teach the baseline of what we need to know as pharmacists. There is no way you could be a healthcare practitioner of any kind without doing a tertiary degree. But change is slow, even if you just look at pharmacist prescribing. It's happening, but it is happening slowly. Looking at guidelines for different disease states versus how accessible that medication is, it takes time. And so something that is really beneficial with NAPSA is that we can get some of these smaller changes out to students quicker. And that's something that I'm really looking forward to working on in the coming months.
Yeah, and I would pretty much just corroborate with what Erin's saying. People or students are looking for extra ways to complement their university degree. You know, the degree prepares them very well to be an intern pharmacist and then a health professional. But most students want a way to sort of buck the trend and be above their cohort. You know, find ways that they can just be that little bit extra before they go out into the workforce. And the things that NAPSA can provide them is exactly that, with our educational program throughout the year and new initiatives like the one Erin just mentioned. It's a way that our students can feel like they're getting more out of their membership as well, and being better health professionals than just with what their university degree is providing them, which is already, you know, a fantastic teaching over, you know, 3, 4, 5 years.
And I just think on top of that as well is that it comes back to the patient. You know, students are, they're looking for, we've just spoken about the time burden of being a student and having to handle work. We've just said, it's tough, but we get it done. But separate to that, things that enhance the degree you're getting, I think, comes back to the patient. And if you can do just, you know, something little every month, every semester to put you a step ahead in your journey to become a pharmacist, your patients are going to benefit so hugely from that as well, which is the whole point of being a pharmacist.
Absolutely. And we're super excited here at Audirie to be supplying AI-powered counseling simulations to NAPSA members starting next year. So be on the lookout for that. And anyone who's listening who's not a NAPSA member, join NAPSA so you can get access to these world first, I would say, simulations for pharmacy students so you can practice your counseling. And it brings me, I actually want to stay on this topic of technology and AI because obviously very much in the news. You guys are on the forefront and launching some AI-powered tools. Sebastian, I'll ask you first, and then Erin, I'd love for you to jump in. Where else do you see AI potentially plugging in to the pharmacy space in a way that assists pharmacists in doing their job? And to your point, Erin, really looking after the patient and improving their ability to look after their patients on a continuous basis. Is there anywhere that you see AI is going to be really helpful, or is this more of a wait and see approach?
I think it's mostly wait and see for me, but I think it will really tie well into the developments in full scope. As more universities look to implement that into their courses, you know, at the moment we just sort of have it at 2 universities, and mostly James Cook University up in the north is delivering most of that program. But I think as the other universities start to catch on to it, more states catch on, it'll be difficult having lots of prescribers ready to do that training. And obviously we're going to still need them for those pharmacists to complete that training, you know, not expecting AI to fill that entire gap. But when there's missed opportunities for a prescriber, or even in the future a prescribing pharmacist to train someone immediately, pharmacists and pharmacy students who want to, you know, get into their full scope work, they could hop on with AI and test out not just their counseling, of course, but how they go through a diagnosis, how they go through that consultation with a patient, whether it's, you know, GORD, or it might be a respiratory thing, or it might be an AI patient with impetigo. Anything, of course, that's covered in those conditions that are now able to be treated by a pharmacist. I think AI can really step in there and act as the patient beyond just our simple, S2, S3, and regular sort of S4 medication counselling as well.
I want to just jump in there, touching on the S2, S3 training. I guess from a scope of something that has come up time and time again when talking about full scope is, oh, but pharmacists already do so much. Oh, pharmacists already stretch so thin. And something that we have heard is, to make this kind of space so full scope can come in is we need to upskill our pharmacy assistants. And I think that AI is going to be such a great tool to use for that. It's going to make this training more accessible for pharmacy assistants. And like Sebastian said, AI is not going to be replacing human taught, like looking at goals. You need someone to sign off on that, absolutely. But it'll be a great way to get that practice in. And trying to upskill some of those other staff members that work in a pharmacy, because it's all about being in a team. It's not all on one person. And I think that that's going to be one of the first steps to getting full scope integrated into pharmacy in a bigger scale, is looking at getting pharmacy assistants upscaled, and AI, I feel, could play a huge role in that.
I think you're absolutely right. And you're right to say that it is a care team, and it's not enough to upskill one portion of that team, right? Because the chain's only as strong as its weakest link. So very much agree with you. We've got to keep that in mind, that it's should be an entire team approach when it comes to education, whether it's education by technology or AI or anything, or just clinical education. Everybody needs to be at a certain level. So I absolutely agree with that. I think that's a great point. And Erin, I'm going to stay with you and ask you a little bit of a controversial question. And I promise I'm not trying to get you kicked out of school. So with that, I'm going to ask you the question, which is, you're now in your third year of pharmacy education. If I give you a magic wand and you could just wave that and change something or some things about your educational experience, what would that be?
Yeah, I mean, we've touched on it a little bit, and this is probably a very safe answer, but the paid experiential placement is so huge. And the way that the degree works in South Australia is I don't do placement till my fourth year. So I know that other unis have already started doing this. And I'm very lucky that we do a lot of counselling practice and kind of that experience practice with our tutors on campus. We have a mock pharmacy we go into every week, and that's how we get a lot of our practice. But then it means in my fourth year, I do 6 weeks, 2 lots of 6-week blocks, completely unpaid. And that terrifies me. And I think that's an easy one, is immediately the first thing that would change, because I love going out and going to work. And when I get to work with different pharmacists, I love it because I want to learn from as many different people as possible. And I am so excited to go and do placement, maybe in a place that I wouldn't normally go, and have experience I wouldn't normally have. And I think that is something that is quite worrying for a lot of students, not just myself. But that would be by far the first thing I would change about my education.
And I obviously agree with Erin. I think another thing which still ties back into placements that I'd love to see change in pharmacy education, and this does vary by university. I can personally only really speak from experience at Griffith and sort of anecdotal experiences from a few other universities, but just more interprofessional education and collaborative practice. When we're looking at full scope and that sort of thing, we want more interaction between pharmacists, physiotherapists, occupational therapists, speech pathologists, everyone in allied health, and general practitioners, of course, and doctors in hospitals. We want to be a part of that healthcare team. And I'd just love to see us work more as students with people who are already health professionals in those disciplines, and people who are studying to be those health professionals as well. Because there's a lot of We hear about turf wars between the disciplines. There's a lot of distrust between health disciplines. Everyone sort of silos into their one degree, which is not a benefit for us as health professionals, but it's definitely not a benefit for our patients, obviously, and they come first. And what I found doing a placement in remote far north Queensland, both community and hospital, was there was so much interprofessional collaborative practice between pharmacists, nurse practitioners, and all those allied health degrees that I mentioned. It was so rewarding to, even on a relatively short placement I was there, to be a part of that, be taught by a nurse practitioner as a pharmacy student was just amazing to me. And I don't feel you necessarily get that experience as much doing a placement, say, in a metro area, in Metro Gold Coast, where I live, Brisbane, Sydney. You really see it in remote areas where where are those gaps in healthcare, where you have to have interprofessional collaboration. Otherwise, the whole system falls apart because there's one pharmacist and one nurse in a town and that sort of thing. But students, they will find it difficult to do a remote placement in far north Queensland or in the middle of the Northern Territory, go to Alice Springs, wherever it might be, if they don't have that financial support, because it's difficult. Whether even if you have your travel and accommodation, they might be paid for by the university, you're still paying rent back at home, and you're still paying for your living expenses in rural areas where costs are generally quite higher because logistically it's hard to get groceries to the middle of the outback. So I just think with paid placements coming in for pharmacy and all allied health, more of us will be able to get out there, get into rural areas, serve those communities, see how great the interprofessional collaboration is there, and then ideally seeing how great it is, then moving there in our internships, post internship, because we've seen it and we want to work there because that's the experience I've had, and that's the experience I know a lot of students have is they want to do rural and remote health once they do the placement there. And right now, there's a barrier in pharmacy education. So those are, I guess, almost the two things that I'd like to see changed if I did have that hypothetical magic wand.
And I think, look, they're always saying we need more pharmacists out in the rural areas, right? You should look, universities, government, I don't know who's listening, but please make it easier for pharmacy students to do that because that's what we all want. We want you guys out there serving rural communities who really have very little access to these resources. And the easiest thing is to pay your way while you're in university so that you don't have to worry constantly while you're out there or not even want to go out there. And then have that experience where you go, well, this is fantastic. I love the experience. I love the people. I love the environment. I want to do at least a couple of years out here. And I think that it just makes total sense to make it as easy as possible for students to be able to do that and have that experience if we want more pharmacists out in rural areas.
Absolutely.
All right, well, let me ask you, Sebastian, this question, and then Erin, I'll go to you for the last question. So, Sebastian, are there any upcoming events, initiatives that you're really excited about that NAPSA is doing, that NAPSA members should really be excited about, and NAPSA non-members should feel very jealous that they're missing out on?
Well, this podcast came at a very good time because we have probably the biggest event of the pharmacy student calendar in Australia coming up in just over 2 months. So that's NAPSA Congress. So it's our annual conference. It's a week-long event. There's education sessions, workshops. There's a trade expo. There's our Pharmacist Student of the Year competition, social events. There's about 5 or 6 throughout the whole week that are all included in the package that students get when they buy a ticket. It's also cheaper to get a ticket than the Medical Students Association convention. I'll just put that out there. So it's really easy for pharmacy students to access. And it's going to be at the University of Queensland next year. Already with our delegate numbers, it's the biggest NAPSA Congress since 2019. So we're very excited about that. Fingers crossed we beat that record. That was at the South Australian Pharmacy Students Association. They held that in 2019, so Erin might not want that record to be broken. But I mean, NAPSA Congress, it's been running since 1952, and we've been an organization since 48. So has a long history. You'll talk to people that literally went to NAPSA Congress 1968 or something, and they tell you about the experience. It was very different back then, and it's just great to know that maybe in 40 years' time, we'll be telling, the students of tomorrow, I was at NAPSA Congress 2025 in Brisbane. This was how fun it was. What's it like now? And I think pharmacy students having the opportunity to have that kind of event when a lot of students don't have similar events for their discipline is something that's really amazing about being a NAPSA member. And I hope to see more of them in Brisbane next year and meet some fantastic students from Australia and New Zealand as well.
Well, look, University of Queensland is my alma mater, so I feel like I should also be there. I don't know, do you have a pharmacy student of the year, but it was a student 25 years ago? Is that pharmacy year minus 25? Is that a thing? Can we make it a thing?
Yeah, we'll bring it in just for you. It's okay.
Oh, thanks. I might win, if it's just for me. I never know. Feeling good about that. Well, Erin, let me ask you last question. If you want to talk a little about your excitement about NAPSA 25 and your hope that it does not do any better than when than a couple of years ago, you absolutely can do that. But also, I want to ask you, for those listening who want to get involved in NAPSA, how can they do that?
I mean, I have to bring my excitement about Congress 100%. I wasn't a student in 2019, so, if it's bigger than South Australia, it just means we'll have to run another one soon and beat you out. This is going to be my third NAPSA Congress next year, and I keep wanting to go because they are so incredible. I just need to echo what Sebastian has said about how phenomenal this event is. And, to get involved in NAPSA Congress and to come along, you need to be a NAPSA member. And to be a NAPSA member, all you got to do is join your local branch. So if you join your local NAPSA branch, you're automatically covered for every benefit that we offer our members at a national level. And then on top of that, you get all your branch benefits as well. I know from, South Australia, you join my branch, you get discounted tickets for events, you get we do some scholarships and mentoring programs that are exclusive then just to South Australian members. And it's completely free to join. You will be able to fill out your form and then suddenly you're a member. And it's such a great way to get involved, both locally within your university and your local pharmacy industry. And then you get all the national benefits on top of that.
Fantastic. Well, I guess we'll leave it there. Erin, Sebastian, thank you so much. I really appreciate you taking the time out of your very busy schedules to talk to me today.
Thank you very much.
Thanks, Michael.
Thanks for joining us today on the Pharmacy View podcast. And don't forget to like, share, and leave a comment if you found this episode of value or have any feedback. Podcast episodes are promoted through social media, LinkedIn, YouTube, and major podcast mediums. And each episode can be found on the Pharmacy View webpage with links to guest contact and business details. If you're a pharmacist or industry support supplier and would like to join us on an episode, send us a message through LinkedIn or complete the inquiry form on the Pharmacy View webpage. I'm your host, Michael Alexander, pharmacist and co-founder of the communication intelligence platform Audirie. On behalf of Shopfront Solutions and Arion Technologies, thanks again for joining us today on the Pharmacy View podcast.